Because we have Dr. Fauci with us to the recommended pause in the Johnson & Johnson COVID vaccine. Joining us now is the director of the National Institute of Allergy and Infectious Diseases and chief medical advisor to the president, Dr. Anthony Fauci. Dr. Fauci, good morning. Thanks for being with us this morning. So let's talk about this pause in the J&J vaccine. The 6 cases of the blood clotting among the 7 million shots that have been given out, less than a 1 in a million chance based on the available data. Can you help explain what's going into this decision, how we're weighing the 6 cases versus the vaccine hesitancy that it's sure to cause?
Well, the FDA and the CDC made a decision based on an accumulating number of cases. Small though they may be, they wanted to make sure they had all the information, and the prudent thing was to say, let's just stop. Very well may be quite temporary, but they just want to take a look and see if they can gather more information or even see if there are more cases that have gone unnoticed. The other reason to do it is actually an important reason, because if there are women out there who've been vaccinated, who do get this really serious syndrome of clots in the brain and other parts of the body, that if they go to a physician, there's a message to the physicians out there that the natural thing that you would do to treat a clot would be to treat a person with an anticoagulant like heparin. That is contraindicated now. That would actually make things worse. So there were twofold reason. One, to just take a look at what's going on. That might just be a few days, a week or so, and then make sure that people out there know how to treat this if, in fact, they encounter it.
Well, I understand that, and that's the FDA's job, and it's clearly doing its job. But again, with the 6 cases, and I don't need to explain to you the context that comes in, if you guys have gone out of your way for months encouraging people that it's safe to get these vaccines, that we need people vaccinated, we need herd immunity. If you want to return to normal life, the vaccine is the answer. And there are so many people in this country, good faith, decent people who just say, boy, I don't know. I've heard about people getting sick and they read things online. So how do you weigh this? If they're the CDC or the FDA, how do you make that decision when you know that it's going to prevent a bunch of people from getting the vaccine down the road?
You bring up a good point, but there's an other side to that story, because much of the hesitancy that we encounter are people who wonder about the safety of a particular vaccine. I mean, I know I'm out there talking to people all the time. This, in fact, is a confirmation of how seriously we take safety. So rather than turning people off about it, if you pause it for a little while and said, you know, we're very concerned to make sure that what we put in your arm is safe. We wanted to take a few days, take a look at this, get more details about it, and then very likely, I don't want to get ahead of the FDA, but very likely they'll say, we looked at it, and now we'll go back, maybe make some modifications. So to me, it's an argument for why you should get vaccinated, because the system is working. The system that is trying to protect the American people is working, which is what triggered the FDA and the CDC to do that.
As you know, unfortunately, a lot of people don't read the fine print. J&J said there's no causal relationship established. We just want to make sure people are aware of this and stop and take a look and make sure there's no link to it. But people will see. I mean, I heard it yesterday. Did you hear the J&J thing? Did you hear if you're a woman between 18 and 48, you might get this blood clotting? This woman died. Another woman's in critical condition. How do you fight back against that kind of information, which is out there, and people will be scared?
Right. Well, you try to be as honest and transparent as you possibly can be and tell people the facts, which we're doing right now when we're having this conversation. You're absolutely right. This is an extremely rare event. There are 6 people in approximately 7 million. That's less than 1 per million. But because of an abundance of caution, they just want to make sure that everything they do is geared towards the safety of the American public. And I think that should encourage people.
Dr. Fauci, Jonathan Lemire with the Associated Press is with us. Jonathan?
Good morning, Dr. Fauci. Good to see you again. As you well know, the Johnson & Johnson vaccine was highly touted because it is just one shot. It can be stored at normal temperatures, and it was being viewed as a vaccine that could really be used in like rural areas, poorer areas, harder to reach areas, both in the United States and then, of course, in the developing world. And we're seeing in the poorer countries really struggling right now with the virus. So can you walk us through just the timetable now? When should we expect a decision from the FDA? What would that entail? And then when would we see potentially the Johnson & Johnson vaccine start going back into people's arms?
Well, what the FDA and the CDC said that this would be a matter of days to weeks rather than weeks to months. So I think you're going to be hearing about a decision of the way forward really relatively soon. What are the options? The options are come back and say, we looked at it, nothing there, not any more than you'd expect in the general population, and go right back to what you were talking about before. Or they may look and say, you know, we still have some concerns. We would like to restrict this to a certain group, whatever that group might be. Or they may be saying, which I doubt very seriously based on this, no, you shouldn't give it anymore. I think one of the first two would be likely, but then again, you don't want to get ahead of the FDA or the CDC. They're looking at the data. I'm not, but I can tell you that's likely what one of the three possibilities are.
So, Dr. Fauci, in closing, just your words earlier in the interview, the pause is because we want to make sure what we put in the arms of the American people around the world even is safe. So what about the people who have taken the Johnson & Johnson vaccine? What's the advice for them? What's the reassurance for them? How should they be feeling this morning?
Well, the first reassurance is to do what I just said a moment ago, and that is this is an extraordinarily rare event, less than 1 in a million. It had occurred in a restricted bracket of time, like between 6 and 13 days. If you had it a month or so ago, I wouldn't even think about it. If you've had it within the last few days to a week, again, you shouldn't worry about it, but just stay heads up for symptoms like headache, abdominal pain, chest pain, and things like that.
All right, Dr. Anthony Fauci, thank you so much, as always, for coming on the show this morning. We will see you again soon.
Hey, thanks so much for watching our YouTube channel. You can follow up on today's top stories and breaking news, or catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.